Hello, everyone, and welcome to our module on cardiovascular response to exercise. In this video, we're going to talk about how your body responds to exercise physiologically. So the first thing you need to understand is that the body's overall goals when you're exercising are to maximize perfusion of skeletal muscles in the heart. You need perfusion of your muscles so you can exercise. You need perfusion of your heart so that you can maintain blood flow to your exercising muscles. But then also the body's goal is to minimize perfusion to other areas, and we'll talk about how that happens. The main initiator for the entire body response physiologically to exercise is muscle hypoxia. When you begin to exercise, you consume oxygen in the blood vessels in your muscles. That leads to hypoxia, and that initiates the body's response to exercise. And the main mediator that causes all the physiologic changes associated with exercise is the sympathetic nervous system. So the whole process of the body responding to exercise begins with muscle contraction. So imagine that you go outside and you start to jog. You're going to contract muscles in your legs. Those muscles are going to consume ATP, and that's going to lead to oxygen being consumed as the muscles try to generate more ATP. And the result is that you're going to develop local hypoxia in the muscle tissues of your legs as you begin running. What's going to happen next is that vasodilation of muscle beds in your legs is going to occur so that more blood flow can get to your exercising muscles. There are lots of mediators that stimulate this process of vasodilation that increases blood flow. The adenosine that's generated from hydrolyzing ATP can cause local vasodilation in muscle beds. Lactate, which is produced when there's insufficient oxygen present, can generate vasodilation. So can carbon dioxide and potassium, and there are many, many others. But the bottom line is that all these mediators generated by muscle contraction will cause vasodilation to occur in muscle beds when you're exercising. And because you have vasodilation occurring, you're going to lower your total peripheral resistance. Remember, the TPR is largely determined by the degree of constriction of peripheral arterioles, and when arterioles begin to vasodilate in muscle beds, that lowers the TPR. When the TPR falls, that's going to activate the sympathetic nervous system. And the sympathetic system is going to do all the things that you know it's capable of doing in the body. So first of all, it's going to stimulate the heart to raise the contractility of the left ventricle and increase the stroke volume. This is a good thing because it raises the cardiac output and provides more blood flow to exercising muscles. The sympathetic system can also raise the heart rate, and as a net result of these two things, the cardiac output goes way up with exercise. And because your cardiac output is the major determinant of your systolic blood pressure, your systolic blood pressure often rises when people begin to exercise. Remember that your blood pressure goes up and down, sort of like a sinusoid here, and when the left ventricle pushes blood out, that drives the pressure up. The more cardiac output there is, the higher that the blood pressure will get driven upwards, and therefore the higher the systolic blood pressure. And so that's what happens with exercise, a rise in the cardiac output and a rise in the systolic blood pressure. The sympathetic nervous system also will cause vasoconstriction to some areas that are not as important to the body, things like the gut and the skin especially. What the sympathetic system is doing is minimizing blood flow to these less important areas and maximizing blood flow to more important areas like the heart and muscles. So on this slide is a summary of the blood pressure changes that are expected with exercise. So as I already said, the systolic blood pressure usually rises. That's because there's more cardiac output. This leads to more blood in the arteries and more pressure in the arteries, and this leads to a higher systolic blood pressure. And remember what I said before, the primary determinant of your systolic blood pressure is your cardiac output. So when this goes up with exercise, the systolic blood pressure usually rises. In contrast, the diastolic blood pressure decreases slightly or stays normal. The reason for this is that process I described earlier. There's local vasodilation of blood vessels in skeletal muscles, and this lowers the TPR. And the primary determinant of your diastolic blood pressure is the degree of peripheral resistance. Remember what I said, blood pressure goes up and down and up and down. How far it goes down depends on the peripheral resistance. When there's less peripheral resistance, the blood pressure tends to fall more before the next upcycle, and therefore the diastolic pressure tends to get lower. Now, because the diastolic pressure is going lower and the systolic pressure is going up, there's usually an increase in pulse pressure with exercise. Pulse pressure is the difference between diastolic and systolic blood pressure. And then, as I've already mentioned, the total peripheral resistance goes down. That's because of vasodilation of blood flow in muscle tissue beds. Shown on this slide are two echocardiogram images of the left ventricle from the same patient. The left image here is the patient at rest, and the right image here is the patient with exercise. And hopefully you can appreciate that with exercise, the walls of the left ventricle are contracting much more vigorously. They're coming so close to one another they almost touch, and that's very different from what's happening at rest. And so if you can remember these images, it's a very easy way to remember that the left ventricular ejection fraction increases with exercise. That's because there's more vigorous contraction of the left ventricular myocytes. Now, in other videos, I talk about the left ventricular ejection fraction and how it's equal to the end diastolic volume minus the end systolic volume divided by the end diastolic volume. Well, the major reason that the left ventricular ejection fraction goes up with exercise is because the end systolic volume gets very, very low. If you look at this image on the right side of the screen, you can see that the amount of black left in the middle of the ventricle after contraction is very, very small. There's a very tiny amount of black, and that represents the end systolic volume. So with exercise, the ESV gets very, very low, and that's the major driver of the increase in the ejection fraction. There are also small changes in the EDV, but these are minor and variable. There are two things going on that affect the end diastolic volume with exercise. One is that there's more preload, but the second is that there's less filling time at fast heart rates. And so let's talk about those two things now. So preload rises with exercise. This is because the sympathetic nervous system stimulates veins. It stimulates alpha receptors in veins and causes the venous system to contract. Your veins are always holding lots of extra blood volume if you need it. And so when the sympathetic nervous system stimulates the veins to contract, they push blood out and send it to the left ventricle. So this increases the preload and raises the end diastolic volume of the left ventricle. And this is another thing that contributes to the rise in cardiac output with exercise, along with the higher heart rate and the contractility increases that we talked about before. Another thing that happens with exercise is the heart rate gets faster. We've already talked about this. And one consequence of a faster heart rate is that the time the left ventricle spends in diastole shortens and becomes less. This allows less time for filling of the left ventricle with blood. And so this is why I said earlier that the effects of exercise on end diastolic volume are variable. That's because you have some things like more preload, which tend to raise the end diastolic volume. Those things are going on. But at the same time, diastole is shortening, and that tends to limit the end diastolic volume. And the net result is that there usually isn't much change to the end diastolic volume compared with the end systolic volume, which changes a lot. Another consequence of the shortened diastole with exercise due to faster heart rates is that there's less coronary artery filling time. Remember, the coronary arteries are unique in that they fill during diastole, not systole like most arteries in the body. So because there's shorter diastole with exercise, there's less time for those arteries to fill. And this could be very, very bad at a time when the heart needs lots of oxygen, except for one thing. The coronary arteries are excellent at vasodilation to increase their blood flow. In fact, this is the only way the heart can get more oxygen is through vasodilation of coronary arteries. It can't extract more oxygen from the blood because it extracts the maximum amount from red blood cells at baseline. The heart is always doing that. It's famous for extracting lots and lots of oxygen from red blood cells. So the only way it can get more oxygen is to increase the blood flow. And the only way that happens with exercise is through coronary vasodilation. And this coronary vasodilation offsets the negative consequences of less filling time from less diastole and allows the left ventricle to obtain more oxygen during exercise, which it needs to meet the increased demand. Lusitropy is the process of myocardial relaxation. It's the opposite of left ventricular contractility. And lusitropy also increases with exercise. This is actually a complicated process regulated by a lot of different proteins and other mediators. But the bottom line is that with exercise, the left ventricle relaxes more, and this allows it to take in more blood. So this increases the preload as well. And this is another contributor to the rise in cardiac output that occurs with exercise. In another video, I talk in detail about pressure volume loops, but I just want to show you this image of a normal pressure volume loop compared to a loop of a person who is exercising. You can see that with exercise, the pressure volume loop gets much wider. The width of the pressure volume loop is proportional to the stroke volume. So the exercise PV loop is much wider because the stroke volume's gone up from more contractility. You can also see that the size of the pressure volume loop for exercise is much larger than the normal one. And the size of the pressure volume loop is an indicator of how much work the heart is doing. And obviously with exercise, the heart is doing much more work compared to at rest. I'll finish with this slide, which summarizes all the physiologic changes that occur with exercise that we've been discussing in this video. So when you begin exercising, that leads to muscle hypoxia and use of ATP by muscle cells. All those mediators are released locally, and that leads to local vasodilation in blood flow to muscles. The vasodilation lowers the total peripheral resistance. In other words, it lowers the afterload on the left ventricle. And as we talked about, this can lead to a small decrease in diastolic blood pressure. But more importantly, the fall in total peripheral resistance activates the sympathetic nervous system. This will have effects on both the heart and the peripheral blood vessels. In the peripheral blood vessels, this will cause arterial constriction in those tissue beds that aren't as important with exercise, things like the skin and the gut. The sympathetic activation also causes venous constriction, and this pushes blood to the left ventricle, raising the preload and slightly raising the end diastolic volume. In terms of the heart, the sympathetic nervous system does three main things. It increases contractility, it increases heart rate, and it increases lusitropy. The increase in contractility lowers the end systolic volume and raises the ejection fraction. This contributes to the rise in cardiac output. The increased heart rate also contributes to the rise in cardiac output, and the increase in lusitropy also contributes to the rise in cardiac output. And because the cardiac output goes up, the systolic blood pressure tends to rise. And that concludes our module on the cardiovascular response to exercise.